This presentation is about the Palliative Care Problem Severity Score, and my name is Sabina Clapham. The Palliative Care Problem Severity Score, or PCPSS, is a holistic tool for initial screening and ongoing coordination of care. It can be used daily or at each patient contact. It facilitates the global assessment across 4 palliative care domains, and it can be used by anyone in the palliative care team. It helps identify overall priorities of care and review the effectiveness of your care plan. It's a clinician-rated measure of palliative care problems across 4 domains of pain, other symptoms, psychological, spiritual, family and carer. How you use this tool is you rate the severity of problems for each domain over a 24-hour period. So you may like to consider asking the question, how much of a problem has this been for my patient today or since yesterday? There are 4 response options. 0 is absent, so there's an absence of problems. 1 is mild, 2 is moderate problems, and 3 is severe. You should also use your scores to help inform your response to the person's problems. For example, if you've scored 3, severe, that means you need to do something urgently in order to respond to that problem. Here are the physical symptoms. Pain problems. With pain, you're rating the overall severity of pain from 1 or could be multiple sites of pain. For other symptoms, you're including any or all physical symptoms other than pain. You may like to refer to your symptom assessment scale to inform the rating. For the psychological and or spiritual problems domain, you're including any or all non-physical symptoms, for example, anxiety. For the family and or carer problems domain, you're rating the overall severity of family or carer problems that requires your response. If the patient does not have any family or carers, then you can score 0, absence, problems, or you can record not assessed. And here are some key messages. These come from our assessment and response protocol. So essentially there's 2 recommendations that with the absent to mild range of symptoms and problems, so in the PCPSS, that's 0 and 1, your response is to monitor and review care plans. In the moderate to severe range of symptom and problem scores, so that's 2 and 3 in the PCPSS, that triggers a set of interventions and actions to respond to those identified needs. And here are the responses for each category broken down into 4. So the absent of 0 means that you can continue what you're doing because what you're doing is working to keep problems absent. Mild is 1. This requires you to monitor, to continue to deliver the same care and keep symptoms and problems in the mild range. Moderate 2 requires you to review and intervene because the moderate range requires an action. And severe 3 requires urgent action. So you need to do something as soon as possible, immediately. This is also from our assessment and response protocol. It combines the SAS and PCPSS together to help inform care planning. So with the SAS, it's the range of 4 to 7. So in the moderate range, the problem and symptom distress actually requires you to change your care plan. It may require referrals and escalation to different members of the team. You need to document, review and implement any new interventions as per your recorded care plan. This patient's palliative care phase may be deteriorating, or if the patient is dying, they're in the terminal phase of care. You can also find on our website many other resources to support you using this tool. There's 2 lanyard cards, the definitions abbreviated and the assessment and response scores abbreviated. Thank you for listening.